Now, let's talk about treatment options for glaucoma. The ultimate goal is simple. It is to stop any further damage to the optic nerve. To do this, we have to lower the eye pressure. Lowering the eye pressure is similar to plumbing. One way is to decrease the amount of fluid coming into the eye. Another way is to make the drain more efficient so that more fluid can leave the eye. Once you lower the eye pressure enough, any further damage to the optic nerve can be stopped. However, this doesn't mean that the glaucoma is cured. With further aging, the drainage system can get clogged even more with time. And this can cause the eye pressure to go back up again, which can damage the optic nerve more. So glaucoma is a dynamic disease that requires a lifelong monitoring. There is simply no one-time cure. Our treatment plan is a stepwise plan. This means we start with the least invasive options, and we climb each step to the next treatment option until further damage to the optic nerve is stopped. First option is generally eye drops. We have to rely on our patients to give themselves these eye drops. There are several different types of eye drops and oral medications. We usually start with one eye drop and we add more medications if we need to. Next option is to use laser treatment to the eye. It is a relatively non-invasive option. The laser makes the drainage of the fluid more efficient, and it can be performed multiple times. Next option include less invasive surgeries. These minor surgeries generally decrease the eye pressure without many side effects or complications. There are lots of innovations occurring in this area, and there are already many different options available now to pick from. Next option include more invasive surgeries. These are more traditional forms of surgeries performed with instruments like blades and forceps. Eye surgeons have refined the techniques of the surgeries with decades of experience. These surgeries are powerful tools that can significantly improve the eye pressure. However, there is still significant risk of complications with these surgeries. Now, let's review an example of a patient with glaucoma. Let's say there is a 60-year-old man. He doesn't have any blurred vision, but he goes in for a regular eye exam, and all of a sudden, he is told that he has early glaucoma. He is started on eye drop treatment. As a result, his eye pressure comes down from 20 to 13. For 10 years, the patient uses his eye drops and gets his follow-up eye exams. Each time, his eye doctor tells him that his glaucoma is well controlled. There is no change in his peripheral vision and his cup-to-disc ratio. However, when he turns 70, the eye doctor says that there are mild changes in his peripheral vision and that the empty space in his optic nerve is bigger, from 40% to 50%, indicating that his glaucoma is getting worse. Then, the man receives a laser treatment, and the eye pressure comes down nicely. He goes on to enjoy a healthy lifestyle with good vision for another 10 years. There is no more change in his glaucoma. Then, when he turns 80, the eye doctor notes some more damage to his optic nerve and his peripheral vision. And this time, the patient gets one of the less invasive surgeries. The eye pressure once again comes down nicely. He continues to live his life to the fullest for another 10 years. And 10 years later, when he turns 90, he is told yet again that there is further damage to his optic nerve. Even as a 90-year-old, he is enjoying good health, so he decides to pursue one of the more invasive surgeries. In this example, this patient is able to keep his vision for 30 years, and likely more. If he didn't catch glaucoma early and receive timely treatment, there is a very good chance that he could have lost his vision years earlier, perhaps even at age 70. And that would have changed his life completely, and for his family and friends.